Hi, my name is Marta Zinyuk, and this is Randall, and I'm recording a video assessment of the skin and abdomen. And this is for NU 650 Advanced Health Assessment course. Randall, do you give me consent to do a skin assessment, an abdominal assessment, and record it?
Yes.
Okay, thank you. I'm going to start by washing my hands and making sure Randall is in the correct position, which he is. As I start inspecting his skin, I can tell that he has very evenly distributed tone. I don't see any cuts, no bruising, no scars. Temperature is within normal limits. Okay. His lips look pink. I don't see any blue. No cyanosis. Okay. His fingers. I don't see any clubbing. No cyanosis. Same for his left hand. Right hand, I'm sorry. Okay. For his toes, I don't see any clubbing or cyanosis either. I'm going to inspect his head now. And his temperature is also within normal limits. Not too much moisture, not too dry. Okay. His sclera looks normal. Okay, I will inspect his head. Okay, I don't see any bulges, no masses. His hair is evenly distributed. He doesn't have any abnormal missing spots. Okay. Alright, no jaundice. Okay, I'm going to have Randall lay down now so that I can do his abdominal assessment. Randall, will you please lay down? Okay, Randall, is it okay if I go ahead and lift your shirt?
Yes.
Thank you. Okay. All right. I will start by inspecting Randall's abdomen. Okay. I don't see any bruising. No scars, no striae, no rashes, no lesions. His abdomen looks flat, no bulges. Okay. I will go ahead and listen to all 4 quadrants for bowel sounds and frequency in a clockwise direction with the diaphragm. Going to go ahead and listen for any high pitch, starting with the left upper quadrant, lower left quadrant, lower right quadrant, upper right quadrant. Okay, all normal sounds They are within 5 to 30 sounds per minute. I will go ahead and auscultate his aorta, and his aorta is below the xiphoid and above the umbilicus. And to listen to his aorta, I will go ahead and use the bell sound, the bell side. Okay. Okay, no broods, no thrills. Go ahead, listen to his right and left renal arteries, which are out laterally. So I'll start with the left, go to the right. No broods, no thrills. I'll go ahead and listen to the iliac arteries, which are below, they're inferior and laterally to the belly button. Left, right. And next I will listen to the femoral arteries. Randall, can I go ahead and just move your pants lower a little bit so I can, thank you. Okay, to the left, femoral, right. I don't hear any broods, no thrills. Okay, go ahead and listen over the spleen on the left side. No venous hums, no friction rub. I'll go ahead and listen to the liver on the right side. Don't hear any venous hums or friction rubs. Okay, very good. Next, I will go ahead and percuss over all 4 quadrants by tapping with my finger. I will start on the upper left, I can hear dullness over the organs, mostly tympanic, and you can hear some dullness. Okay, all right, I'll go ahead and estimate the liver span, which will be between the upper and lower borders, beginning at the mid-clavicular line, and percuss until I hear dullness. Okay. It's about 9 centimeters, which is normal, as its border should be about 6 to 12 within normal limits. Okay. Next, I will go ahead and do some palpation, and I will go ahead and start with some light palpations to help Randall's muscle get used to that touch and sort of be relaxed for when I do the deeper palpation. So, okay. I'm doing this over all 4 quadrants as well, to feel for any rigidity, lumps, any guarding. And then I will go ahead and do some deep palpations, feel for any masses, any organs. Okay. I will go ahead and palpate the liver edge, and I can do this by the hooking technique by placing down and upwards. Okay. You could feel the spleen as well. However, the spleen is hidden by the rib, so it's unlikely to feel much here. Okay, go ahead and feel his kidneys. Okay, feel the other side. And his right kidney is slightly higher than his left. Okay, the next Randall, I'm just gonna go ahead and assess a few signs with a few techniques. 4 of them will assess whether you are at risk for appendicitis. Okay, so the first one is called McBurney's point, and this is the imaginary line that will go from the umbilicus to the anterior superior iliac crest. Okay, so it's that line, and about halfway through the line is where the point, the McBurney's point is. Okay, does this hurt, Randall, when I press? Okay, so Randall is negative for his McBurney's point. He doesn't feel any pain. Okay, the next technique I'm going to use is called the Ross swing, and with this I'm going to feel for some rebound tenderness by pressing on Randall's left lower quadrant to see if he feels any pain on his right lower quadrant. So Randall, I'm going to go ahead and press now. Do you feel any pain?
Nope.
on your right? Okay, very good. Next is what I'm going to do is the psoas sign, and this is when Randall, if you elevate your right leg against my hand. Okay, does that hurt? Okay, very good. So by flexing his psoas muscle, it would if he had an inflamed appendix, the psoas muscle would irritate that, and it would cause him to feel pain. The next technique I'm going to use is the arboretus sign, and this is when Randall will flex your right leg at the hip, okay, and bend towards. Okay, very good. Do you feel any pain?
No.
Very good. The next, the last sign is actually a sign to check for cholecystitis, and this is done by palpating the upper right quadrant, okay, and asking Randall to take a deep breath. Randall, will you take a deep breath? Okay. All right, do you feel any pain?
No.
Okay, very good. Perfect. Okay, and the last thing I'm going to do is checking tenderness over his kidneys. So Randall, if you can just sit up for me. Perfect. Just like that. Okay, very good. Does that hurt?
No.
Okay, very good. Thank you. Randall, thank you.
Thank you.